Good afternoon. This is Stephanie Boyd-Serafin from the National Resource Center for Permanency and Family Connections. I'd like to welcome you all to our webinar entitled Addressing the Use of Caseworker Visit Funds. It seems that there's a great interest on the part of states to hear what others are doing to enhance caseworker visits, as we have over 100 people registered for this webinar. The Children's Bureau, the National Resource Center for Permanency and Family Connections, and the NRC for In-Home Services are hosting this webinar to address the use of Caseworker Visit Funds in keeping with the Child and Family Services Improvement and Innovation Act. State foster care managers and Promoting Safe and Stable Families program grantee managers are the audience for our call today, and our agenda is as follows. Gail Collins, who's the Director of the Division of Program Implementation with the Children's Bureau, will provide an overview of the federal requirements relating to caseworker visits with children in foster care, and also a brief overview of the caseworker data the states have submitted for the fiscal year of 2007 to 2011. Then there will be representatives both from New York and Georgia who will provide state examples presenting their use of caseworker visit funds. And then following the presentations, participants will be allowed to ask questions of the presenters. We've allotted time until roughly 4:15 for the webinar, and if there are questions that we're not able to answer given the time constraint, folks can send those questions to Tracy Sergenian, who's our Information Services Director, and we can respond to them. Also, this webinar will be archived on the National Resource Center for Permanency and Family Connections website by next Wednesday, so people can take advantage of that if colleagues weren't able to listen in on today's webinar. So with that, I will let Gail Collins begin the presentations. Gail?
Thank you. It's my pleasure to participate today. So as was indicated, I was asked to just do kind of an overview of the federal requirements that are in law, and I'll be giving a review both of amendments that were made to the federal Title IV-B programs in 2006, and also some amendments that were made more recently in 2011. And as part of that, also just be giving a little bit of a snapshot of what the data show as to how states have been progressing in terms of making caseworker visits. So if we can actually, I think, move one more slide, please. Thanks. So starting now with the 2006 amendments to the Title IV-B programs. The Child and Family Services Improvement Act of 2006 amended Title IV-B both in Subpart 1, the Child Welfare Services Program, and Subpart 2, the Promoting Safe and Stable Families Program, to include a series of provisions that were intended to ensure that children who are removed from home and placed in foster care receive regular visits from a caseworker. And the provisions added to the law included new funding, a requirement that states have formal standards requiring monthly visits, and also a series of data reporting requirements. Next slide. And there were a couple of things that were at least of note in influencing the inclusion of these requirements in the federal law. One was that we were highlighting findings from the first round of the Child and Family Services reviews that found a strong correlation between frequent caseworker visits with children and positive outcomes for these children, such as timely achievement of permanency and various indicators of child well-being. Another factor was that there had been an HHS Office of Inspector General report that found that only 20 states were actually able to produce reports to show whether or not caseworkers actually visited children in foster care on at least a monthly basis. So that was of concern that states were not actually able to produce clear data on whether children were getting visited. Next slide. So in adding provisions to federal law, we'll start with the giving money part. The law set aside funds for a formula grant to states to support monthly caseworker visits with children in foster care, with an emphasis on activities to improve caseworker retention, recruitment, training, and the ability to access the benefits of technology. Funding was provided starting in fiscal year 2006, and you can see on the screen the pattern of funding that was provided. just for further context, this was provided out of a pot of money that was split between this purpose for caseworker visits, and the other part of the money was going to support the regional partnership grants, discretionary grants that deal with families with substance abuse issues. So it was a little bit of an odd funding scheme for a few years there, but has wound up at the $20 million per year level. Next slide, please. So that was in the Title IV-B side. There was new money. On the Title IV-B1 side, there were several new requirements. One, that the states were required to describe standards for the content and frequency of caseworker visits for children who are in foster care, which at a minimum ensure that children are visited on a monthly basis, and that caseworker visits are well-planned and focused on issues pertinent to case planning and service delivery to ensure the safety, permanency, and well-being of children. So states needed to describe those standards in their 4B plan. Next slide. Then there were requirements relating to the submission of data. So states were required to submit data beginning in fiscal year 2007 on the percentage of children in foster care under the responsibility of the state who were visited on a monthly basis, which we interpreted, and we think in a fair interpretation of the law, as meaning that each child, that each and every calendar month they were in care, they had a caseworker visit, and that the percentage of the visits that occurred in the and to report the percentage of visits that occurred in the residence of the child. So the baseline data was submitted for fiscal year 2007. Then states were also required to set target percentages to be reached so that by October 1, 2011, at least 90% of children in foster care are visited by their caseworkers on a monthly basis, and that the majority of those visits occur in the residence of the child. Next slide. States were also required to establish an outline of the steps they would take to ensure that they would reach that threshold of at least 90% of the children getting visited on a monthly basis, and that visits were occurring in the residence of the child. And they were to describe the steps that they were going to take, and these steps could include activities designed to improve caseworker retention, recruitment, training, and ability to access technology. Next slide. The law also established a fiscal sanction if a state failed to meet targets. Now, each state set its own targets for fiscal years 2008, 2009, et cetera, with the goal, again, of reaching that 90% by fiscal 2011. And states started from all different places. When we started, some were at 2% and some were at 90%. So each state kind of had to lay out its own path for how to meet that. But once those targets were set, there was the requirement that federal financial participation under the Title IV-B Subpart 1 program, which is normally 75% federal share, be reduced in proportion to the amount that the state failed to reach its target. So whatever the target the state set, that was the benchmark we were comparing it to. And while this is sort of a penalty, it's not quite a penalty, because while the amount of federal share was reduced, the state could still draw its full federal allocation, but to get the full federal share had to increase the state match that was being shown. This chart shows you how the fiscal sanctions work. So depending on by how much you miss the target, they're either if it's less than 10%, a 1 percentage point reduction, next threshold being 3 percentage points if the target was missed between 10 and 20%, and if you missed the target by more than 20%, then there was a 5 percentage point reduction in the federal share. Next slide. So I thought while we're reviewing all the requirements, you'd like to know how states have actually done. Next slide. So this just provides an overview kind of from the national perspective. So looking at that fiscal year 2007 being the baseline year, the average percentage for all states of the percentage of children in care receiving a caseworker visit each and every calendar month they were in care, that was 42%. with each year, that percentage has gone up. So you see then the next year it reached 50%, then 63, 71, and as of fiscal year 2011, the national percentage is up to 74%. The bottom line of that chart, you'll see that the number of states that achieved their specific target percentages each year. For 2008, 2009, and 2010, each state had its own target percentages that were set by the state relating to its specific need to improve. But for the final year shown, fiscal 2011, all states were required to meet the threshold of at least 90% of kids getting visited monthly. And there were 15 states that did achieve that, but others did not quite make that, and therefore were subject to the fiscal sanctions we were speaking of a moment ago. The other thing that we have been collecting data on was the percentage of the visits that occurred in the residence of the child, and the previous statute just said that the majority of these visits should be in the residence of the child. And as you see, performance in this area has been pretty strong. The baseline was 69%, and that has gone up to 84% in fiscal 2011, with only one state currently not meeting the target of having at least 50%. So if you interpret majority of being 50% or more in the home, only one state had data lower than that. So we've just been talking about the provisions as they were put in the law in 2006. More recently, we had a reauthorization of the Title IV-B programs. The Child and Family Services Improvement and Innovation Act, PL 11234, was signed into law this past September 30th, and it revised the requirements relating to the submission of data and performance standards for monthly caseworker visits with children in foster care. The law did change both the standards for performance and the way the percentages relating to monthly caseworker visits are calculated. The law also reauthorized and revised the purpose for the monthly caseworker visit formula grants. Next slide. Okay, so here's the data part. As amended, the law now reads that each state must meet the following performance requirements for monthly caseworker visits, beginning with fiscal 2012. So for each of federal fiscal years 2012 through 2014, the total number of visits made by caseworkers on a monthly basis to children in foster care must not be less than 90% of the total number of such visits that would occur if each child were visited once every month while in care. Then when we get to fiscal 2015 and years thereafter, that standard will go up to 95%. And then we have also a new standard, or numeric standard, I should say, for the number of visits made in the home, where before it just spoke to a majority, it now says at least 50% of the total number of monthly visits made by caseworkers to children in foster care during a fiscal year must occur in the child's residence. We issued a program instruction back in January that really details the caseworker visit data requirements. I'm not going to attempt to repeat everything that's in that PI, but if you're interested in how all this is to be calculated, please do take a look at that. It is on the Children's Bureau's website. The PI does clarify the reporting population, the method for calculating percentages, as well as the fiscal consequences if a performance standard is not reached. I wanted to highlight just a couple of the key changes between the old way and the new way of calculating visits. And the most important key change, I'd say, is in the framework for measuring caseworker visits, shifting from counting children who received a visit each and every month they were in care to counting monthly visits and comparing that number to the number of visits that would be expected of each child in care were visited at least once per month. And this change really addresses a concern that a number of states had raised, that they essentially were not getting credit if they missed 1 month in, a child were in care for 8 months and they visited them 7 of the 8 months. They sort of didn't get credit for those 7 months, and now they do. Next slide. The law made some changes, but kept the basic structure of the fiscal sanctions, whereas before it only applied to meeting the targets for monthly caseworker visits. It now applies both to the monthly caseworker visit percentage and also to the percentage of visits in the residence of the child. Again, as in the past, the full federal allocation will still be available to the state. However, higher state match is required to draw down the full allocation. So again, Title 4B normally has a 75% federal share, 25% state match. Depending on the amount by which a target is missed, the state match could go up to 26%, 28%, or 30%. And that, again, just shows the framework for the amount by which you might fall short of a performance standard, what the change would be in terms of the federal match and requisite state match required. Okay, next slide. Then the other thing the law did was to extend the monthly caseworker visit grants under Subpart 2. And they made some change in the purpose for that grant. The law now specifies that the state agencies must use monthly caseworker visit funds to improve the quality of caseworker visits with an emphasis on caseworker decision-making and caseworker recruitment and retention. Whereas before there were different amounts per year, now it's set at $20 million per year in each of fiscal years 2012 through 2016. Next slide. I just wanted to put the old definition and the new definition up on the screen at the same time. They are similar but not identical. So again, the old one had to support monthly caseworker visits with children in foster care with an emphasis on activities that will improve caseworker retention, recruitment, training, and the ability to access the benefits of technology. The new one is to improve the quality of caseworker visits with children in foster care with an emphasis on caseworker decision-making and caseworker recruitment and retention. So you'll see some of the wording is the same and some has changed. There's still the emphasis on recruitment and retention, but there really is now a shift, particularly focusing on quality of visits, not just getting them done. Okay, next slide. In the Annual Progress and Services Report, which is the Title 4B plan, annual submission that was due this past June 30th, states were required to indicate any changes in their planned use for the monthly caseworker visit funds to be consistent with the new statutory requirement. And we also required that states describe the action steps they're going to take to ensure that the total number of monthly caseworker visits to children in foster care is not less than 90% of the total visits that would be made of each child were visited once per month for each of fiscal years 2012 and 2013. After that, of course, it goes up to 95%. We did receive a number of questions, including some in advance of this webinar, that were kind of about specific things of can we spend money on XYZ, or we were spending money on this, can we still do that? And the guidance I give folks is that, generally speaking, provided you can provide a reasonable rationale for how the proposed use meets the current statutory purpose, so that new purpose, and provided it doesn't violate any other applicable restrictions, we'll consider it. And the specific questions that you might have about whether your state can spend money on a particular thing are best addressed through the regional office, so it can be discussed in the context of your specific plan and specific use, and given a close look, But generally, if you can make a rational linkage between what you want to do with the money and how it supports the current statutory purpose, that generally should be okay. I don't recommend offering a Ferrari to your caseworker of the year. That probably wouldn't fly. But short of that, we probably can be fairly flexible. And I think that's it for me. So thank you. And I'm not sure, are we moving on to the next presentation then?
Yes, Lisa, are you there?
I'm here. I thought we were going to do the introduction. Okay. I'm sorry.
Okay, we can start with, yes, that's right, Karen. Yeah, thank you.
Okay. Sorry about that. This is Sharon. Yes, I'm going to introduce Lisa Gotti Odom-Dini. I hope I'm pronouncing that right. She is the Assistant Commissioner in the Office of Special Populations within the Division of Child Welfare and Community Service. Lisa portfolio includes supervision to the Bureau of Monitoring, Training, Data Bureau, in the Bureau of Waiver Management and the Native American Services. She has implementation responsibility within the Child Welfare Community Services for a number of federal initiatives, including the Fostering Connection to Success in promoting safe and stable families, Caseworker Visit Grant, and also the National Youth in Transition Database. She has a bachelor's degree from Georgetown University and her law degree from Pace University School of Law. So, Lisa, you can begin now.
Thank you, Sharon. Good afternoon, everyone. Next slide. You can move to the next slide, please. We can make one more move. So by way of background, just so that everyone can understand the system in New York, the New York State Child Welfare System is supervised by the state through the Office of Children and Family Services and locally administered by counties. And here we use the local Department of Social Services as well as private voluntary agencies. So in an effort to implement the provisions of the Act, OCFS initially sent out letters to the commissioners of social services as well as the executive directors of the voluntary agencies, advising them of the requirements of the law. We reviewed our data and set the benchmarks to be reached. Next slide, please. OCFS also completed a case review of a sampling of case records in the social services districts as well as many voluntary agencies. As a result of this statewide review, we compiled a compendium of best practice guidelines as well as key barriers that we saw were impacting the ability for caseworkers to timely make their monthly visits as well as the meaningful, not impacting their ability to have meaningful visits with children on their workload. Next slide, please. The best practice guidelines, I thought we'd go through that first. For the local districts, the commissioners as well as the executive directors, it was deemed it would be best for the administrators to be engaged with the staff and understand the importance of the monthly face-to-face workers by the face-to-face visits by the caseworkers, and incorporating the use of data and management reports to help the staff meet their benchmarks. The feeling was that this had to be a top-down approach. Next slide, please. In addition to the administrators, there was an understanding that the supervisors also had to conduct regular staff meetings, discuss the activity between the caseworkers and the visits with the families, focusing on the outcomes of the visits. And again, this was stressed by Gail, not just making sure that they're making the visits, but also the quality and impact of the visits that are occurring on a monthly basis. We encouraged the supervisors to review progress notes on an ongoing, regular basis, and also use the data reports that we provide here in OCFS to assess the timeliness and the quality of the visits. Next slide, please. For caseworkers, the importance was placed upon understanding this initiative, not just being another initiative that sometimes some caseworkers feel that there's so many new initiatives, but understanding the importance of a face-to-face contact with the children and engaging with the families as well. We developed an online training, computer-based training program for caseworkers with a compendium desk aids to assist and provide further understanding of the requirements of the law. Next slide, please. As I stated earlier, we encouraged all parties to utilize the data that we compile within OCFS and provide to the local districts and the voluntary agencies. To implement the caseworker contact initiatives, we developed a more detailed series of reports. For caseworkers, we developed reports that show the caseworker the activity by their contact activity by worker. For supervisors, they were able to see the activity by their unit or their worker, as well as those that were no successful contact summaries for their units and workers. For managers, they were able to see activities by the unit as well as the no successful contact summaries. We also provide quarterly reports for the local districts as well as the voluntary agencies, which shows a comparative of performance in both districts and the agencies, as well as and then we developed a report which is an open caseload inquiry report, and that can show the worker in real time which children on their caseload have not yet had a face-to-face progress note completed and documented, and that can be pulled down by the 20th of each month. Next slide, please. In doing the review, we also were able to develop what we deemed were barriers to the successful monthly contacts, and we were able to break it down to 3 areas: software, training, and technology. To address the issues for software, we had to develop, it was deemed that we needed to develop worker-friendly software that would ease the ability for the caseworkers to successfully document their contacts with the children in their care, on their workload, training. As I mentioned earlier, we needed to develop a training for the caseworkers to understand the importance of this, as well as the specific requirements of the law. And technology. It was found that there was a need to upgrade the technological capacity in the field. New York is a large state, and you have varying differences between New York City and some of our rural communities. So we needed to procure computer equipment, software, telephones, including mobile telephones, as well as the ability to Wi-Fi ability for caseworkers who are out in more rural areas as well. Next slide, please. When we spoke, and I spoke about the software update, as you can see from this current slide, this was the change that we made to our connections, which is where the caseworkers would report their visits. So this is a sample of what a caseworker's workload would look like. Next slide, please. By the change that we were able to make, the caseworker, as you can see, they can select the contact by month. You see that you can click on the search button. You can check by each individual child. The worker can then click on the search button. Next slide, please. You can select a person, and then you can also select the missing contact by month link. Next slide. So as you're now when you drill down deeper, as you can see from this window, you can select the progress note link, list of months, and it'll list the number of months for the reporting period. Next slide. And if there is indeed progress notes that are deemed missing, you can go in and add the information. And because it's in real time, the workers are able to see, as opposed to it lingering for too long, as to what information is missing. Next slide. When we were discussing the reports, this is a sample of the summary that we provide to the local districts. And the importance of the reports, as I stated before, is to make sure that the field has an understanding as to where we are before we actually have to report to the federal government. So this summary is available to the local districts as well as the voluntary agencies on a quarterly basis. And this is information that's compiled by our data warehouse here in OCFS. And next slide is just another example of that. Next slide. When part of the use of the money, part of one of the uses of the money was to hire business analysts. And these business analysts were then assigned to our regional offices, notably in the regions where we deemed that there was poor performance. The business analysts then go out and have continual conversations with our local districts as well as our voluntary agencies to go over the data, to help explain the data and break it down further if anyone is having any difficulty, or really to help show them what we're seeing and provide assistance as to what areas we can help them in to make the contacts as needed. This is an example of a report done by one of our business analysts in New York City for just an example of the kind of conversations they would have with a voluntary agency. So as you can see, based on the data that's compiled here in OCFS, they're looking at the different reasons that a contact could have been missed. Next slide. Then further breaking down, looking if we're in March, these are the reasons that have been addressed on a monthly basis, and then on a cumulative basis, where are the issues? And what this helps them do is it directs the conversations and drills down and really does help the districts and the agencies focus their attention in specific areas where they're having difficulty. Next slide. This is just yet another example of the comparisons that are done for the agencies and the districts. And again, each business analyst will conduct their conversations in different manners. They will make requests to us of different data pulls that they would like to further assist their particular region. Next slide. And this is another example as well. Next slide, please. So just as we were saying earlier, the use of the money within New York was partially the training and technical assistance was a key component. The computer-based training that we developed was called Documenting Caseworker Contacts with Foster Children. It's online and available for all caseworkers, and we refresh it as changes come up or new areas that are pointed to us from our business analysts or requests from the field as well as to things that they would like to know. We also developed a companion desk aid that is available, and we send it out as requested when there's turnover in the field as well. And then, as I mentioned before, the business analysts were hired, and they provide the technical assistance to the field and also field back to us during we have monthly meetings with the business analysts here in OCFS, and they field back to us the problems that they're having in the field, the problems that they're hearing from the field, in making the contacts, and then we can then further follow through, and if there's any other action that we need to take to provide assistance to the field to make sure that they're able to make their contacts. Next slide, please. So the technology that we purchased, and I mentioned earlier, the laptops, the MiFis, we also did digital recorders, voice recognition software, the Dragon Speak technology, as well as the use of iPads in certain districts and voluntary agencies, and cell phones. And what we found with the technology, it increased the ability for the districts and the agencies to modernize, but also it does impact the quality of the visit. Now, a caseworker can spend a little more time during the visit, have a more intense visit, they can make the contacts and all the corresponding information right there at the home where they're making the visit, as opposed to rushing back to their office in some way. So the technology was twofold, and the benefits realized have been twofold. And that's it. Thank you so much.
Okay. Thank you. Thank you, Lisa. And now we will have Kim Coombs. She is with Georgia Division of Family and Children's Services. She has been there since September 2001, and in that time, she has worked in promoting safe and stable families, strategy, planning, and Medicaid. She is now working in the federal regulations and data within the Accountability Research and Evaluation Unit, where she has served as the as the team leader and principal member of the State Child and Family Services Plan since 2006. However, Ms. Coombs continues to serve as the coordinator for Georgia's Every Child, Every Month, which is Georgia's monthly caseworker visit project. She holds her master's degree in public administration from the University of Oklahoma and a degree in journalism from University of Georgia. Kim?
Hi, can everyone hear me? Me? Stephanie?
We can hear you.
Okay, all right. You can go ahead and advance to the slide that says Georgia Strategic Plan. Okay. As you all know, in Georgia, in 2007 was the first year that we received the legislation to meet that we had to meet the target criteria and to set our baseline. So in 2007, the state of Georgia, in the promoting Safe and Stable Families unit, at the time was headed by the director Ann Pope, and I was also in the Promoting Safe and Stable Families unit at the time, and we came up with a 5-year strategic plan to achieve our targets. We also, as Sharon had said, we named the project. Here in Georgia, we call our project Every Child, Every Month. We are, after we determined our baseline, we decided in our strategic plan we would have we would focus on these 5 key elements. We'd increase system capacity for data collection and reporting, update and revise our policies, provide staff and supervisor training and technical assistance, increase emphasis on quality assurance, and develop a workforce incentive program to engage our staff and leadership. There was a focus on all of these areas to some degree in each of those years, but as you can see as the list on the right, that there was a particular emphasis in each year of our plan, and we're going to go through how we focus on each of those areas. Next slide. The first area, we spent 2008 focusing on the training. The state worked with the National Resource Center for Family-Centered Practice and Permanency Planning around February of 2008, and we took an existing curriculum and it was revised and then infused with Georgia-specific detail by a caseworker visitation strategic team. Our education and training unit staff, course participants, and NCR course trainer also helped to revise the curriculum. The training helped staff to understand the importance of having meaningful and purposeful visits with children in care and helped the staff gain skills in planning, preparing, engaging in, and conducting appropriate visits. The staff learned a 4-step process in preparation, engagement, debriefing, and next steps on how to conduct successful visits that ensure caseworkers develop a connection with the child, identify the child's needs, and use information gathered on visits to make case plan decisions, and also to accurately document the visit. We had we started with a pilot training of about 120 staff statewide. Georgia has we have about 159 counties and approximately about 1,700 social services case managers. But after we had our pilot and revamped the curriculum, we had a 2-day, 12-hour train-the-trainer. We had 10 1.5-day trainings to our remaining foster care staff, 5, and we also trained our CCI and CPA, child placing agencies and child caring institutions providers. We also provided a webinar for our CCI and CPA providers because we also developed, which I'll talk about a little bit more later, but we did a provider portal for them so that our placement providers are able to document their visits to children via the Internet on a secured portal of our SACWA system. Although they do not have full access to the SHINE system, once the CCI or CPA staff have been designated authorized users by their agency, they are able to detail accounts of their visits to children in care into our SACWA system. This provider portal increases expediency and accuracy in the documentation process by eliminating the need for DFAC staff to duplicate, rewrite, or re-enter contact data that's submitted by providers. Our training, promoting placement stability through caseworker child visits, is incorporated into our ongoing new worker training and our ongoing professional excellence training as well. Primarily, our expenditures in the training area was on travel reimbursement, site facilities, paying for breaks and meals and materials, and training coordination. You can advance the file. In 2007, the state SACWA system had not yet been fully operational, so we kind of took advantage of that because we were still in the construction phase, we were able to build certain enhancements into the system. Our SACWA system is called SHINES here in Georgia. And what you see here, these are some of the major enhancements that we focused on. We did, one of the first ones we did was called external documentation. And this is kind of an archive feature in our SHINE system, which allows users to upload and file scanned documents such as case data, court and legal data, foster, adoption, health, and other information. This system has a cataloging feature so that files are better organized and easily retrievable. The user can sort for documents associated with specific persons in the case and search by multiple document types and dates. And this helped to decrease the amount of time that they had to input data from visits and research records for upcoming visits. It also helps to improve the accuracy in that it decreases the amount of information that must be rewritten or retyped into the system. One of my favorite enhancements is our Case Watch page. On this page, it'll tell the user immediately if a visit was made, and the page will also indicate whether the visit was actually made in the home. It will show whether the case manager actually spoke privately with the child during the visit. And there are other features included in this. There are case warnings. They warn the user of approaching dates and deadlines. There are alerts of possible case errors in the case record. There's at-a-glance summaries of information. And one of the things I really like is there's a really prominent visual graphic that highlights the child's length of time in care. The page captures data on investigation response times, current risk levels, current custody status, health case plans, review dates, family team meetings, and so much more. We also developed our SHINES reports. The system, however, needed to be fully operational for an entire year for us in order to generate a complete report exclusively from SHINES, and we were finally able to do this by about 2009. And Tracy, I'm sorry, I can't see my slide in front of me, so you can advance to the next slide that says Sample Sackless Shines Report. I'm not sure if you're there or not.
Yes, I just advanced to that slide.
Okay. All right. On our Shines reports, we can view visits that were made or not made by a DFACS case manager. We can pull the list by state, region, county, and or a case manager, and we can view various reporting periods by either a month, 6 months, or year, however. This particular report is one we rely on the most to develop our report for when we report to the Children's Bureau whether or not we have reached our targets. And this is what you're looking at will show pretty much the last page of the report, where it actually, prior to this page, you would actually see a list of children, and the children will be sorted by county and region or case manager. On this particular page, you can look and it'll break it down by how many children were seen in the way that we were required to do it before the new standards came out. And it also now has a section where it looks at just whether or not a visit was made when a visit was required. These Shines reports are pulled weekly, and they're shared in cadence meetings. The meetings provide an opportunity for open dialogue about the progress being made toward making visits to children consistently, and these meetings have been instrumental in discovering ways to improve the reporting process, peer sharing of useful techniques, and celebrating successes and motivating our staff. State leadership, data analysis specialists, regional directors, county directors, and our field program specialists all participate in these cadences. You can advance to the sample lens report slide. This is one of those quick at-a-glance dashboard reports, scoreboard reports, that the user can pull up and look at the immediate month at hand. And this is one of those times where you actually want to drop the ball, because those little red dots are what we call balls, and the lower the ball, the more kids that have actually been seen. Now, this report was pulled very, very early in the month, so that's why you see a lot of the red balls still way at the top of the chart. You can advance to the next slide to sample this next sample lens report. These dashboard reports can show monthly trends and yearly trends. Staff can compare either a month this year to another month in the same year, or they can compare a month to prior years. And they can do the same thing with looking at a long-range yearly view as well. Using these trend charts, the leadership can use these lenses to pinpoint specific areas needing improvement. And these reports also have drill-down elements that also sort by region and county, and it generates a specific list of children and their case IDs and the case manager's names. And it's the same thing with the lens report that you saw prior, with the green bars and the red balls. Same thing, during that month, a caseworker can look at that list and immediately pull up right at that very moment, at any day of the year, pull up that chart and find out and pull a list of all the children that have not yet been seen on their caseload, or have not yet been seen in their county, or not yet seen in their region. The user can also hyperlink from the child's name in that list to read the full case record and the documentation in Shine. You can advance. Now, this sample lens report is for our in-home visits view. And we typically in Georgia do pretty well on this. So I actually had to color in some of the red and the yellow bars to show you what it actually would look like had we had made less than 60% or 50% of our visits in the home. So the yellow bars would indicate less than 60%, and the red bars would indicate less than 50%. And then you can advance the next slide. This is our visitation compliance lens report, and we developed this report in our efforts to try to get to look beyond just the frequency of visits and whether or not a visit has or has not been made, and try to get more at quality of visits. This particular report focuses on visits to not just the child, but also whether or not visits were made to caretakers, fathers, and mothers. The case is not considered, however, to be in compliance unless all the required contacts for the family have been met and the contacts meet standards set forth by the standards that were set forth by our Quality Assurance Unit. The Quality Assurance Unit perform intensive case record reviews using tools that mirror instruments used during the CFSR. They check the record to see if the visit was purposeful and meaningful and whether concerns for the child's safety, permanency, and well-being were addressed. Our Program Evaluation Analysis Section staff, we call it our PEAS unit, they perform qualitative reviews and are able to read full narratives regarding visits in the SHINE system. They are able to assess whether visits focus on safety, permanency, and or well-being to facilitate service coordination and delivery of one or more case planning goals. The statistics, trends, and outcome measures derived from the reviews are also shared with state staff in monthly meetings where staff are given the opportunity to provide feedback and postulate on strategies to address concerns. Analysis of these data also helps to answer inquiries such as how timely and frequently visits are documented, and does the frequency of visits and length of visits correspond to better outcomes, and what kinds of issues are actually being addressed at the visit. You can advance the slide. By 2010, we were well aware that at this point some of our staff may have been getting every child, every month fatigue, and so this was a good year to really ramp up our efforts on our workforce incentive program. And our workforce incentive program also had a name. We call it Going the Extra Mile campaign. And it's a campaign to promote positive and long-lasting change in practice and performed by maintaining a motivated and stable workforce. Local county offices are actually able to track their own progress now, as you can see, because of all the various lenses and reports that we come up with. So they're they can more frequently track their own progress and therefore reward their staff for their accomplishments. Excuse me. Once staff completed their Every Child, Every Month training, they had received commemorative lapel pins. And throughout the 5-year plan, other incentive mementos such as certificates, posters, stickers, and related trinkets were also distributed to show appreciation or award staff for their efforts. Staff are also able to display their progress that they have tracked in display cases. And if you look on the slide in the bottom corner of the slide, that's an example of a type of chart that would actually be displayed at the local level. It would not be as complex as those reports you saw before. It would be something more along the lines of something more quickly at a glance and user-friendly. And we also try to use branding in a way. We try to be consistent with our graphics so that every time someone would see a certain picture or graphic, they'd immediately be able to relate it back to Every Child, Every Month. And although it sounds like a simple thing, it actually was very, very helpful to eliminate or decrease any confusion between the monthly caseworker visit targets and standards project with other projects. And you can advance the slide. After receiving federal guidance on the new allowable uses of funds for federal fiscal year 2012, we developed a strategy team of field program specialists and supervisors from regions who have done particularly well with making quality and frequent visits to children in care, and to come up with some ideas. And on this team, we had also had staff from our education and training unit. We also had PSSF unit represented, and we also had members of our human resources department represented as well. As a result of the strategy team's proposal, the state looked at, one of the big things that they came up with was supervisor summits. We learned that there was a very high interest in improving supervisor staffing with case managers and helping supervisors to be better coaches and mentors. So what we're considering during this is allowing the regions to select their own specific topics for their summit, so long as that the overarching theme remains on making quality visits and or caseworker decision making. Also, in this process, we began to explore procurement of voice dictation software to decrease the amount of time a case manager spends typing notes and entering data into the SHINE system. The hope is that this software will allow a case manager to not only dictate notes more speedily, but also improve the quality of documentation by decreasing the amount of time that lapses between a visit being made and the findings being recorded. And we're hoping that case managers will not have to wait till they get back to an office or to a stationary work area to record their notes into the SHINE system, and they can do it while the details of the visit are still fresh in their mind. However, about 92% of our social services case managers respondents said that they would consider using voice dictation in their work, and a little bit over 80% actually strongly desired it. So it was a very popular idea. However, we still are in exploratory. We're still exploring this because there are some concerns. There are some people who are not necessarily technologically savvy or not likely to even want to use the software, and some may actually find that it's more tedious than helpful. So we're still exploring that. And also, we're going to allow our field staff to provide, we're going to continue our Going the Extra Mile campaign and encourage our regions to provide workforce retention incentives. So this concludes my report for Georgia, and I thank all of you all for this opportunity to share our work.
Thank you so much. So we'll now move to questions, and we have about 15 minutes for questions and discussion. And if you have a question or something you want to bring up for discussion, if you could just press *1 on your phone, and then I'll unmute your line. Okay, and while we're waiting for the questions to come in, I'll just let you know so that we can have as much time for the questions as possible, that after the event closes, we're going to have a feedback survey sent to the participants, and we would appreciate your feedback to help us plan our future events. Materials for this event are currently posted on the NRC TFC website at the site where you registered for the event, and that includes this PowerPoint, the agenda, and also a listing of the examples of ways that different states have been using Caseworker Visit Funds that the PSSF managers and foster care managers reported when we asked that question prior to this webinar. And we're going to have the webinar archived next Wednesday, as Stephanie mentioned, and here's my email for the follow-up. And we do have our first question. Great. So, Cindy, your line is unmuted.
Hi, this is Cindy from Pennsylvania. I have one question and one point of clarification. Did you say that the questionnaires that folks submitted discussing different things that they've used Caseworker Visitation Funds for will also be posted along with the webinar?
Yep, they're actually already posted on this link that you see there. We didn't put which states were using things for which purposes, but just a general listing of the different ways the states have been using the funds.
Okay. And if we have questions or want to get more specific information, do we just email you?
You can email me, and then I'll either respond or put you in contact with the appropriate person to respond, definitely.
Thank you. And my actual question, I guess for both of the states, New York and Georgia, the improvements or the changes that you've made to your SACWA systems, did you use Caseworker Visitation Funds for those improvements, or was it just because your SACWA system was not yet created, it allowed for enhancements?
Hello, this is Georgia.
Okay.
We used a combination of funding for that. Yes, we did use some monthly caseworker visit funds along with some state funding.
Okay, thank you.
Hi, this is Lisa from New York. Yes, we did use the caseworker visit funds to make our enhancements.
Okay. Thank you very much.
Okay, and we do have another question. Regina Arrowwood.
Hi, this is a question for Georgia. In terms of your toolkit and notebooks that were used to enhance the quality of visits with families and case managers, is that something that would be accessible to others to take a look at or available?
Yes, definitely, absolutely. My email address is on the front page of the presentation, and you could email me and I could send it to you. But yes, our curriculum, and it was developed in concert with an NRC trainer, Rose Went.
Mm-hmm.
She would also be a good resource.
Thank you.
Okay, so we don't have any further questions at this time, but I'll just give another minute so people can ask them if they want. *1 on your phone. Stephanie, it doesn't look like we're getting any other questions at this point.
Okay, Tracy. Well, I just want to thank everyone for joining us today. Thank you to all the presenters. It was a very rich presentation with lots of pertinent information. So I thank you to everyone, and we look forward to the next webinar that we'll provide. So thanks, everyone, and we look forward to